UPMC in general is very committed to the quality more than the quantity of what we do. Each campus of UPMC is a bit different. We are a very personalized approach, and so we're a bit smaller, but we still have all the same resources that the entire UPMC community has. And so we are in contact with the biggest implanters of TAVR valves, sort of the cutting edge research in EP technology and cath technology is all happening in Pittsburgh. And we're part of all those conversations. So every time there's a global meeting or a staff meeting or something else that's coming up, we're every part of that. We do a bunch of differently minimally invasive procedures. And so we've been doing robotic bypass surgery, which I think is unique for the UPMC system for years, through a relatively small chest wall incision using the robot. We do minimally invasive lung surgery where we use the robot to do entire lobectomies through a 3-centimeter cut on your side rather than a large thoracotomy. And then TAVRs, these transcatheter aortic valves, are probably the most minimally invasive thing that we do, where it's either through just a poke in the groin or maybe a 2-centimeter incision near the arteries in the leg, and we can replace the entire aortic valve without having to use the cardiopulmonary bypass machine or do any sort of major surgery. Being part of the bigger system means we have more options for patients that we didn't have before. So even if something isn't locally available or the experience for something isn't here, the experience exists within this bigger system. And we are able to float doctors and technologies between hospitals so we can provide the same level of care here that once was only available to someone who would have to travel 4 hours out to Pittsburgh to get that. And I think that's a very unique experience where the system is willing to transport people and transport ideas and technology from hospital to hospital rather than trying to ship the patients around.